Hi, I'm Dr. Noelle Lucas from Blue Oasis Pet Hospital, and I'm here to answer a few more questions that you have about your dog's preventive care. And I have my husband, Alex, who's going to ask me some questions that you guys still have about that.
So what kind of information does my vet need to know about lifestyle before building any kind of preventative care recommendation?
Yeah, that's a great question. Actually, that's one of the first questions that we're going to ask. After we give your introduction, make sure that you don't have any questions or concerns about your dog's just general health. We're going to ask, what does your dog do when they're outside of our hospital? What kind of lifestyle do they have? Are they going to just, be a little Pomeranian that's just pretty much, in the house and they don't really go out and about very often? Are they, an Australian Shepherd and they go to daycare and they go hiking and they just have a really active lifestyle and they go swimming? So we want to know about your dog's lifestyle because we're going to make recommendations for you and your dog specifically on what kind of life that they live.
So what kind of recommendations will it make to my dog's preventative care plan with lifestyle choices and things like that?
Well, one of the big things that we're going to probably recommend with lifestyle is we're going to probably recommend some different vaccinations that are going to be due for your dog depending on their lifestyle because they're going to come across more infectious diseases than a little dog that never goes outside. So vaccination recommendations will probably change. We might also make some nutrition recommendations that would be different for your more active pet as opposed to more of a house pet that's a little bit more sedentary and doesn't really get out for exercise very often. So really nutrition and vaccinations will be different. And then in just terms of like what is happening in an exam room when we're going through a preventive or wellness appointment with you, what your veterinarian is going to really be focusing on is just good physical exam, just, how does your dog look? We're going to focus on oral health. What does the teeth look like? What dental disease do you have? Can we partner with you in doing some home care? And, what does that look like for dental home care? One of the first things that I see when I walk into a physical exam for a dog is just what's their general well-being? What do they look like? Are they heavy? Are they thin? What's their hair coat look like? I just can see a lot right away about body condition and if we need to partner with you in changing their nutrition, or maybe I give you a lot of encouragement because you're doing a really great job in controlling that dog's weight. Most of the time we'll have a conversation about nutrition. Also, I want to see, is your pet microchipped for safety? Because I want your pet to always come back to you. We're going to talk about just how's your pet moving around? Are they able to do all the same things that they used to be able to do, jumping up on furniture? Are they having any problems getting in and out of the car? Just mobility issues that they might be having. I'm going to ask you about. So really it's just about also, what preventatives are they on? Are we keeping them protected from flea, tick, and heartworm on a regular basis? What vaccines do they need to have? It's based again on lifestyle. Do we need to maybe add some more in because they're more active in going to daycare than we used to know? There's just a lot of things to talk about in a good wellness exam for your dog. So, we're going to partner with you to find what's the best, most customized care for that pet and their lifestyle when we're together.
So what's the difference between pet insurance and a wellness plan?
Oh, those can get confusing, right? So let's just talk about a wellness plan or preventative care plan, as they're also known. So they are either something that your veterinary office will offer, or they are through a third-party provider, because you can go out on the internet and find some preventive care plans that you pay somebody else, but they'll pay your veterinarian when you consume those services. So a preventative care plan is we're going to take just those normal things that we're going to do for preventive care, like exams, vaccinations, maybe some flea, tick, heartworm prevention, heartworm testing, fecal exams for intestinal parasites, maybe some annual blood work. So those would be kind of encompassing what is just normal preventative care. And then that plan, you're going to pay for those services, but you're going to pay for them over time. So you're going to pay once a month for a package of services that are going to be used for preventative care. And then insurance is kind of how you and I use insurance sometimes right now, where you need to go for an illness. So you have some illness, so your pet and your dog has maybe some vomiting, diarrhea, maybe has an ear infection, maybe it's been traumatized in some way, had a dog fight, and now you have a medical issue that you're going in for your veterinarian for. Pet insurance will help cover for medical care associated with injury or disease. So insurance is more for medical, and preventative or wellness plans are to help pay for care of that pet's preventive care over a year's time. So that's kind of the difference between preventive care plans and pet insurance.
So how do I keep my dog safe in a car?
Oh, car safety. So, well, it really depends on your pet, right? If you have a big dog, you might want to have a seatbelt harness for them. So there's some harness systems that they can sit in the back seat. Ideally, they go in the back seat. Ideally, they're actually seat belted in. If you have a dog that has a crate in the back, you have a minivan or SUV, and you have a kennel that can go in the back of your vehicle, so you can actually put them in a safe, confined kennel. That would be great. Car safety for smaller dogs can also be like there's some really nice pet beds that they kind of sit up so they can look out, but they're also harnessed in. Where your dog should not be is sitting on your lap while you're driving or in the front seat untethered, because that is a safety hazard for you and other drivers and your pet as well.
And so, how do I keep my yard and house safe for pets, for dogs specifically?
So keeping your yard safe for pets. Well, if they go outside for potty breaks, which all dogs do, and you don't, so fence, right? Fence would protect them from other animals coming into their environment, including other dogs that might want to attack them, and also from your dog being able to just run freely. So fencing, if you don't have a fence, it's okay, because not a lot of people do. Put your dog on a leash and go for a walk. So you want to have some leash, and you have to know your leash laws in your community. Of course, we live in a suburban area here in Mount Juliet, so there's leash laws. You have to have your dog on leash. If you have an underground fence, there's the electric fences. That's okay. They're not my favorite because it's giving a negative shock to your dog. That's a negative experience for them to keep them in your yard. But if you have one, you want to make sure you're partnering with a trainer or some positive reinforcement training to happen so that they understand where those boundaries are in a positive way instead of just learning from a negative way. But also you have to remember, if you have an electric fence, other animals can run into your yard, and that doesn't stop them from harming your pet. So that's one of the things I don't like about electric fences as well. It does not keep your dog safe all the time. So those are just some thoughts about keeping your dog safe around your house.
So what's the most common dog health conditions that can be prevented with a good wellness plan?
That's a big, broad question about what can be prevented from, what diseases can be prevented from preventive care. Well, we're going to prevent from distemper disease, parvo disease, hepatitis, and parainfluenzas. When we give our just general core vaccination, we can 100% protect your pet from rabies with rabies vaccinations. Dogs also are exposed to mosquitoes, and we can keep them safe from heartworm disease. Tick diseases are huge in Middle Tennessee, which is where we live, and it only takes about the size of a poppy seed tick. So the tick that spreads disease is usually in their smaller forms, and they're very tiny, about the size of a poppy seed, and they're the ones that are going to pass Lyme disease and Ehrlichia and Anaplasma. We can keep going with tick-borne diseases that we can actually prevent your dog from getting with good tick prevention. So there's a lot of diseases that we can prevent your dog from getting when you just come in and see us on an annual basis. We're here to help you. We want to help to protect your pet from these diseases. It's our job to keep your pet safe for you to enjoy as many years as you possibly can. So if you have any real lingering questions or concerns about your dog's preventive care, just feel like you just, have some more questions to ask, please make an appointment with your veterinarian. If you happen to live in the Mount Juliet or Nashville area, we'd love to see you guys here at Blue Oasis Pet Hospital. Please make an appointment.